Good morning, YouTube. This is Ken from Just For You Swag Bags and Gifts .com, coming to you from the great state of Georgia. Happy to be with you this morning. Uh, Today's topic is Black business and the Delta variant. Just want to talk a little bit about this pandemic situation and how it's affected Black businesses and the development of Black business, and also how it's affecting the Black community. I know that we've all been through a pretty rough last year and a half, and we still appear to have a long way to go. So the question becomes, why haven't the Black community increased its vaccination rate uh, to prevent the spread of the Delta variant within the community, and whether Black businesses are on board with helping to encourage our communities to get inoculated and vaccinated against this particular variant. There are new variants that seem to be popping up all the time, and but the Delta variant seemed to be the most prevalent variant at this particular point. I'd like to know, and you can email us at justforyourswagbags@gmail.com, and we will post your comments to our website and the like. How do you feel as a Black entrepreneurs and Black business people around vaccinations in the Black community, whether you've encouraged your employees or colleagues to get vaccinated, and any and all steps that you're taking to help um, maintain a safe environment for your customers, your employees, and others who you may be working with. Since we're an e-commerce business here, we don't have a lot of contact with outsiders, and specifically in direct contact with consumers. Our contact is through mail and through emails and the like, where we're taking orders and we're shipping out products to various parts of the country. But still, it is incumbent upon us, even as entrepreneurs, e-commerce entrepreneurs, to be aware that the variant can affect us all. It can affect us when we go to drop off packages at the post office or at the UPS store or the FedEx. And even when the delivery is directly door to door, kind of pickup and delivery systems, it's still a possibility of exposure. And so we have taken a position that we need to be fully vaccinated. Those of us who do work here need to be fully vaccinated, and that we need to, in all particular cases, when coming in contact with others, wear a mask. And I'm wondering whether these are some of the policies and procedures that are going to be permanent within the business community, and particularly within the Black business community, since we seem to have the lowest rate of vaccination among all the populations in the United States. And this may be because of a number of reasons too. Of course, there's been a wide availability of vaccination sites, but in the rural areas where a lot of Black people still live, Black residents still live, they may not be able to get as easily to vaccination sites and the like, and to get vaccinated. And this may be contributing to also the low rate of vaccination. The other factor may also be is that the historic um, events that have taken place in regards to Tuskegee experiment and other experimentations that have taken place against our population, Black population, may make us kind of weary of having anyone to inject anything into our bodies, especially since we're not medical personnel and we don't know specifically what mRNA is or any other kind of uh, inoculation or vaccination terms. We don't fully understand that because we're not medical people. We do remember, however, having heard horror stories about Black men being infected with syphilis disease and then allowed to rot away as a result of the lack of medical care in order to appease the scientific um, quest or uh, for others, basically. And this has been imprinted upon us time and time again. So it makes us kind of leery in terms of getting inoculated. But we have to also remember that we have been inoculated against many diseases in the past without harmful effects in most cases. When I was a child, it was mandatory that we were inoculated against the polio virus and other diseases, the whooping cough, uh, measles, mumps, rubella. Um, we got these inoculations, and there was no question about it. It was basically mandatory. We didn't know what was in the vaccination at that time, but it seemed to work. And so I guess part of the message has to be in terms of not only investigation of what is being injected into our bodies, but also to have some kind of trust that the medical profession that is administering this, on the most part, on the greater whole part, are trying to do the right thing. Now, as you remember, one of the developers of this vaccination was a Black scientist, one of the scientists who helped to bring this vaccination to the forefront. And it has been widely successful in the prevention of the spread of disease among more than over 180 million people within the United States. And it's also being used worldwide. So the bottom line is that we do need to encourage people not only to investigate the uh, vaccination for themselves, but ultimately to get the vaccination in order to help stop the spread of this virus or this disease within our community. Why is this important to Black businesses? It's very important to Black businesses. Since many Black businesses exist within the Black community, and we have our retail stores and outlets, service shops, service professionals, and the like within the Black community serving people. Well, if our people are not vaccinated, then it can decimate that population that we're trying to serve. And as such, it stymies the economic development of the Black business and the Black community. We should be trying to grow more businesses within the Black community. We should be trying to employ more people from the Black community within our business. And we should be also trying to transfer knowledge to others within the Black community so that they can start and develop their own businesses. This can't happen as long as we're lagging behind in vaccinations and inoculations and preventing this disease from spreading within our community. And we're going to have to really kind of work on this a little bit more and help to get the message out when people come through our doors and the like, to encourage them in a gentle manner, not aggressively, not the overpowering message to them or the like, but basically the benefits of getting vaccinated. They may not know the benefits of it. And you may be a trusted source for them, the person that they see every day at their local grocery store, or that at the barber shop, or the hairdresser, or the accountant, or the mechanic, and the like. They probably will listen to you. And so I would encourage, if you're in business, to try to encourage your customers and others within the community to get vaccinated so we can stop this disease from spreading among the Black community. Do you know that Black community has the lowest rate of vaccinations right now? We're lagging behind Hispanics, behind Caucasians, and definitely behind Asians who have a higher rate, almost an 80 to 90% rate of vaccinations. And as such, we need to look at that critically in terms of how this variant is affecting our community and why we're lagging so far behind at this point. And also the impact that it puts upon the limited medical resources that are already in our community. You know, we don't have a lot of medical resources in the Black community. We usually the last to be served in medical facilities and the like. We usually have the most dire diseases when we do seek medical attention because either there wasn't the availability of medical services to us or we allowed ourselves to not make to take advantage of those services that was. And so the disease has progressed to the point that it takes a lot of medical resources in order to help us to get healthy again. Uh, what are some of the kind of ways that we can uh, help to stop this variant? Well, of course, the first would be to get vaccinated, fully vaccinated, if possible, within your community. The other is to, of course, wear a mask. I still wear a mask in church at this particular point, even though 80 to 90% of the congregants, my fellow congregants, have been vaccinated, okay, and then inoculated against the variant and the like. I still wear a mask because there's a likelihood that there is a 5 to 10% of people within the congregation who are unvaccinated for whatever reason that they may have. So that would be also to wear masks, also to wash our hands thoroughly each and every day, especially when we're out and we're touching different surfaces and the like, and to avoid touching our face and around, especially the openings of our mouth and our nose. Also, we should encourage our children to wear masks. I don't care what some people say. Our first obligation is to protect our children, not only ourselves, but to protect our children. And if wearing a mask because they cannot get inoculated at this particular point against the variant, if wearing a mask will save their lives, then that's what we need to do. Children like to wear masks. Okay, they like to dress up, they like to play superheroes. So get them a mask that has a theme to it that they like, a cartoon character, a superhero, or some other kind of figure or saying that they like and can get accustomed to. And then you won't have too much of a problem with them wearing a mask. Teach the children why they should wear a mask and how to properly wear the mask so that they are protected themselves. And then, of course, there's a lot of discussion going on in the country right now about wearing masks and freedom and this. Well, we all have freedoms. You know, we have a freedom not to wear a mask. We have a freedom to get sick, but we don't have a freedom to make other people sick and to spread diseases and the like. And as such, those who do not get vaccinated, who do not wear masks, who do not take safety precautions, are sucking up the resources of the medical community from others who need those medical resources, who need heart transplants and who need operations and the like. to save their lives, who are mortally wounded or desperately wounded through accidents, car accidents, and the violence that are taking place within society and the like. Well, we don't need our hospital beds, and especially ICU units, filled up with people with COVID because the disease is preventable, and yet they won't get vaccinated and the like. This is a double-edged sword. Yes, you have freedoms, but your freedom is now impacting upon others, and that's not a good situation. Okay, again, this is Ken from Just For You swagbagsandgifts.com. Hoping that you, as Black business people, we take in consideration the effects of the Delta variant on our community and on our customers, that we work to help to get better medical information out to our communities and to encourage members of our communities to get vaccinated, to stay healthy, to protect themselves, and to protect their children. We want to have a thriving Black community population for generations to come. And we want to build our businesses and to employ our people and others. And the way that we can do this is to help to spread the word that the vaccination, wearing the mask, protecting ourselves, following medical procedures, washing our hands, and avoiding certain kinds of behaviors that lead us to becoming disease ridden and contracting the virus. Again, this is Ken from Just For You swagbagsandgifts.com. Next week, we will be again posting to Facebook next week the conversation that we had with Crystal Philip Pierce on Friday in regards to creating great celebrations for the upcoming holidays and how to do that safely as well. Okay, hoping that you have a great Saturday. We'll see you again soon. This is Ken from Just For You swagbagsandgifts.com signing off.